Hello! Are you confused about cluster A disorders? Not sure what schizoid, schizotypal is? Want to know the difference? Then keep watching. Once again, today we're discussing personality disorders. This is meant purely for educational purposes and is not intended to be medical advice or to treat or diagnose anyone. Cluster A disorders are behaviors that are described as odd or eccentric, and they include paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. One little visual mnemonic that I liked was this paranoid personality disorder get fact. So individuals with paranoid personality disorder, they hold grudges for long periods of time. They feel they're being exploited, even though there's no basis that they're being exploited. They often doubt others, right? So trustworthiness of others is doubted. They feel like everyone is out to get them. That is really the essence of paranoid personality disorder. I'm constantly looking over my shoulder and who's coming to get me? Who's coming to get me? Are you after me? Are you going to get me? They may question their sexual partner. Are you cheating on me? Why do you smell like this? Why do you smell like this perfume? Do you have cologne on you? Whose cologne is that? Is that lipstick on your collar? Attacks on character are perceived. For example, they think that people are you judging me right now? Are you saying that I'm lazy? Any little thing, they perceive it as a threatening remark. They don't confide in others, which is another reason why therapy is difficult because they're not going to open up to their therapist. And they read threatening meanings into events. So it's very exasperating because you could just be talking to this individual completely not meaning anything negative, and they're like, what do you mean by that? Do you mean that, are you calling me a liar? I'm not a liar. I never said I was a liar. So it's very difficult to kind of get these individuals to open up and know that you're not judging them or you're not out to get them. So once again, people with paranoid personality disorder, they have a pervasive feeling of distrust. They may not lack delusions, but they do feel that people are acting maliciously against them. So for example, my teacher gave me a low grade on my assignment because she's out to get me. They may believe in conspiracy theories, right? The CIA covered this up. There's a lot of people I know that believe in really outlandish conspiracy theories. And they're often litigious, so they're likely to sue and they're very unhappy. Like Zig Ziglar used to say, he says, I tell you the same thing 50 different times because it helps cement it in your brain. So once again, with paranoid personality disorder, distrust and suspiciousness of others, they believe that others want to exploit, harm, or deceive them. They're hyper vigilant. They anticipate hostility. They may provoke hostile responses. Their relationships are difficult due to jealousy, controlling behaviors, and unwilling to forgive. Remember, they hold that grudge for a long time. Projection is a dominant defense mechanism where people attribute their own feelings to others. For example, they may accuse their partner of being hypercritical when they themselves are fault finding. Or another example, they're the ones that are cheating on their spouse, and yet they're the ones that, who are you talking to on the phone? Who are you messaging? Who are you texting? Who's that? Is that a guy friend? You can't go out with that guy friend. Exactly. Guidelines for their nursing care. Appointments and schedules should be strictly adhered to. You don't want to be too nice or friendly because they may get suspicious. You want to be very clear, straightforward. In order to explain tests, procedures, you want to use simple language and project a neutral but kind affect. You want to be a blank canvas for them so that they don't misinterpret something that you're doing. You want to provide limit setting when threatening behaviors are present. So let's say they get very hostile and angry. In a calm manner, you explain to them that their behavior is inappropriate. Treatment for paranoid personality disorder. They often tend to reject treatment, number one. Psychotherapy is the first line of treatment. Group therapy is threatening to people with paranoid personality disorder. Again, they feel others are out to get them. Diazepam may help with anxiety and agitation. Remember that that's a benzodiazepine. Haloperidol is a first generation antipsychotic, and it may help with severe agitation and delusions. And pimozide is another first generation antipsychotic. It may reduce paranoid ideation. Next, we're going to discuss schizoid personality disorder. I really like these little cartoons because I'm a visual and I feel like it will help you remember them. Schizoid personality disorder. These individuals tend to live a solitary lifestyle. They're indifferent to praise or criticism. They're odd or eccentric. Relationships are of no interest. Sexual experiences are of no interest. They may never have a friend or a girlfriend or a boyfriend. Activities are not enjoyed. Again, friends are lacking. They're emotionally cold and detached. So, for example, hey, you're invited to my birthday party. They may not even say thanks. They'll just say, no, not interested. Facebook. Look, this person has 5 friends. Okay, look at that. That is way too many friends. I need to cut some off the list, right? They have very few friends. Little to no interest in sex or romantic relationships. This guy says, I've come to woo you. And she's like, go away, please. And then she's knitting or crocheting. I don't know the difference, but she enjoys solitary activities. Another way of just telling you again, schizoid PD, lifelong pattern of social withdrawal. They have a restricted range of emotional expression. So this is all you get. They're just flat pan. I'm not showing you any emotion. This is all I do. They're viewed as odd or eccentric. They have discomfort with social interaction. They tend to be loners. They do poorly in school. They're often bullied because they are odd, so they're ridiculed by their peers. And they don't really care though. They don't look for approval nor rejection of others, and it doesn't seem to have much effect on them. And friendships, dating, sexual experiences are rare. They feel as if they are detached from life. They feel as if they are the observer rather than a participant in life. And they may have feelings of depersonalization or detachment from oneself in the world. They may feel like they're in a dream and they're just watching this unfold. Once again, here's the pattern for cluster A. Avoid being too nice or friendly. Do not try to increase socialization. Patients may be open to discussing coping and anxiety, protect against ridicule from group members, and conduct a thorough assessment in case they're having thoughts of suicide. Treatment. Psychotherapy can help. It may improve sensitivity to others and social cues. Antidepressants such as Wellbutrin may help increase pleasure in life. Risperidone or olanzapine, those are second-generation antipsychotics, are used to improve emotional expressiveness. So from this to maybe this, schizotypal. So as you can see, this is Willy Wonka from Willy and the Chocolate Factory, Johnny Depp. And with schizotypal, the way that they dress is very, again, odd and eccentric, and they stand out from the crowd. With schizotypal, they have unusual perceptions. So they'll be the kind of people that believe in these conspiracy theories with the Illuminati. They have unusual perceptions. They're friendless except for family. Odd beliefs, thinking, and speech. Notice how this person believes in astrology, and it's not to say that everyone that believes in astrology is schizotypal, but it's just these are the characteristics of an individual. So believing in like tarot cards, astrology, the Illuminati, their affect is inappropriate, constricted, they have ideas of reference. They're also a little suspicious, they're eccentric in appearance and behavior, whereas the schizoid not stand out in as much in dressing, whereas the schizotypal does stand out in the manner in which they are dressed. And they're reluctant in social situations, and they can get very anxious. They can get severe anxiety. So with schizotypal, they don't blend in with the crowd. Their symptoms are strikingly strange and unusual. Notice how they said strikingly. They have magical thinking, beliefs, strange speech patterns, and inappropriate affect. Those are the hallmarks of this disorder, the magical thinking. So for example, let's say that I got mad at someone, and if I was schizotypal and I said, man, I wish that person's tires, that person would get a flat tire. And if they did, if I'm schizotypal, I think I caused that flat tire just by me thinking about it. They have severe social and interpersonal deficits, extreme anxiety in social situations. That's the takeaway with schizotypal. They're overly suspicious and anxious. They misinterpret motivations as others as being out to get them, a little bit there on the paranoid side too. They have odd beliefs or magical thinking. For example, he caught a cold because I wished he would. What differentiates the schizotypal from the paranoid is that with the schizotypal, there's paranoia, but again, there's the odd beliefs and the magical thinking. So if you see on an exam where they're asking about magical thinking, it's going to be schizotypal. Psychotic symptoms may exist, but to a lesser degree and only briefly. And schizotypal, the difference between schizotypal and schizophrenia is that with schizotypal, they can be made aware of their suspicious, magical thinking, and odd beliefs. Whereas with schizophrenia, it's so fixed, they don't realize that what their misperceptions are. Respect patients' need for social isolation, be aware of patient suspiciousness, and employ appropriate interventions. Perform careful assessment, and be aware that strange beliefs and activities may be part of the patient's life. Treatment for the schizotypal includes psychotherapy. They may be involved in cults, unusual religious groups, and engage in occult activities, so making them aware that this is not healthy. There's really no specific pharmacological treatment. You have to treat the symptoms. So they may benefit from low-dose antipsychotic agents. If they have depression and anxiety, then obviously you would treat those with antidepressants and anti-anxiety agents. Thank you so much for watching. I hope that you learned plenty today about cluster A disorders. Bye.